We are taking a look across the country with a focus on rural America, where local officials are telling NewsNation they're afraid the worst may be yet to come, and they may not be ready when it does. NewsNation's Tom Negevin live for us in New York with our report. Tom?
Right, Joe. Outside a city MD where locals come to get their COVID tests, Manhattan succeeding thus far in flattening the curve, but upstate, the COVID outbreak leading to a high-profile resignation. At the State University of New York at Oneonta, the president has quit only weeks after recording the most severe coronavirus outbreak of any public university in the state. Last month, more than 700 students here tested positive as college campuses across the country are thrown into turmoil by the COVID pandemic. In North Dakota, doctors are locking horns with the governor over masks. He says their effectiveness is inconclusive. They're begging for a statewide mask mandate. October's on pace to be North Dakota's deadliest month since the pandemic began.
As a person who has had patients die, I can say that this decision is a no-brainer from a public health or physician perspective. If we're talking about the loss of life, we're going to see more and more of that.
In South Dakota, new data reveals COVID cases are taking up over 20% of beds in intensive care units as the state acknowledges medical staff may be spread too thin.
There are times we ask patients to receive great care, but perhaps in an unusual location.
Tonight, extra personnel and supplies are being sent to battle a spike in COVID hospitalizations in West Texas. In Lubbock,
over the last few days, we've seen at least 200 cases per day.
Way too many, officials say, for a city of 250,000.
We have seen an increase, a pretty significant increase in COVID-19 cases, both in the El Paso area and in the Amarillo and Lubbock areas, which then, creates more hospitalizations.
Hospitals are the issue in Mississippi, where state health officials say they're facing a looming crisis. 6 hospitals with no adult ICU beds. In other words, nowhere left to treat the most serious COVID patients.
We may head back to having more and more mandatory masks if we can't do it voluntarily. So if we could do things voluntarily, I think that just makes so much more sense.
Across the board, across the country, state health officials are saying they're not seeing enough mask wearing, not seeing enough social distancing. Worried, they say, that we may be letting our guard down as Americans at the worst possible time. Live in New York, Tom Negevin, NewsNation.